Yeah, on that note, thank you, Senator. And Congressman Beyer was actually, and he and I were sort of channeling each other. Where I'm trying to get is a model where AI makes traffic better, where AI helps me attach an air quality monitor to these things, and we crowdsource our environmental data, where AI is, and I accept some of that becomes technically an algorithm underlying. It's actually not, crawling through a stack. But even where Congressman Beyer was, the ability to revolutionize the cost and delivery and efficacy of healthcare. Of what was it, about 3 weeks ago, a month ago, we had one of the first drugs solely designed by AI, a new molecule that looks like it has a remarkable efficacy. How do I get this to move fast? Because I believe cures are moral. And it's an interesting, is the solution an environment, as you and I think about policy, is it taking a look at the outcomes and making sure those outcomes are effective, in some ways moral, efficient? Because if we don't do something fairly dramatically on the cost of delivering services, I mean, yesterday we borrowed $101,000 per second over the last 366 days. It's a leap year. If I had come to you a few years ago and said we're going to be over $100,000 a second in borrowing, and almost all the growth of borrowing is interest. Interest now will be number 2 in our spending stack, and the growth of healthcare. I mean, am I channeling you appropriately?
Wholly, very much so. It's just terrifying to think that interest on the debt is greater than Medicare, greater than Medicaid, greater than the defense budget. Only has to catch up with his discretionary non-defense.
Yeah, just Social Security.
And Social Security, yeah.
So as I come to all of you, you have the ginormous computers and lots of technical data that is not public. You have the next generation students. You have the policy, and you have the case of how we could revolutionize healthcare. How do I deal with the fact that when he and I have actually had conversations of telehealth, digital health, the fact of the matter is, in many ways, you know this because you sat and we talked about it. If the pandemic hadn't happened, I don't know if I would have ever gotten our telehealth bill a single hearing. It only moved forward, and because apparently grandma wouldn't know how to work FaceTime. Turns out she's really good at it. I don't believe the next generation is talking to someone on the phone. I think it's reading the data off my body. How do I sell this story, Dr. Miller? How do we sell the morality of doing it better, faster, cheaper, and much more accurately?
I think it's immoral not to do that, right? So if we don't give patients the choice of having cheaper, more efficient, more accessible, more personalized care, I think that we would be making a massive moral error. You mentioned telehealth. 20 years ago, if we talked about telehealth, people would say that we were cuckoo for Cocoa Puffs, right? Because no one's going to call their doctor or do Skype or FaceTime. And now it's the standard. It took a global pandemic where 1 million Americans died for us to have telehealth. So I think the answer is one, hopefully we don't have another global pandemic, but we don't want to wait until there's some catastrophic event until we offer automated or autonomous care, right? If you're a poor American with chronic disease, autonomous and automated care or AI-assisted care is basically the best thing ever, because you will get more access, you'll get higher quality, and it's going to be cheaper. So I personally think that we have to do it. It's not a choice.
Mr. Thier, and it's you, I know you're going to respond to that. Does it make a difference in our world that, 3 weeks ago, Apple finally got its next generation of watch for cardiac arrhythmias, those things, substantially certified as a medical device? Is that what you were talking about, the next generation disruption is coming?
Yeah, absolutely. And to answer your question, Congressman, about how we essentially sell these benefits, we talk about it in terms of opportunity costs. Like, what would we be losing? So what kind of foregone innovation would we lose if we don't get this right? Well, we can put our numbers on this. Let's talk about some of the biggest killers in America today. 800,000 people lose their lives to heart disease. 600,000 people lose their lives to cancers every year now. I mean, how about cars? Let's talk about public health and vehicles. I mean, every single day, there's 6,500 people injured on the roads in America. 100 of them die. 94% of those are attributable to human error behind the wheel. I have to believe that if we had more autonomy in the automobile sector, we could actually make a dent, excuse the pun, in that death toll. Yeah, and so I mean, this is where we can talk to the public about like the real world trade-offs at work if we get this wrong, right? I mean, we've had a 50-year war on cancer that goes back to the time when Richard Nixon was in office, and you know, we've made some strides, but we could make a lot more if we had serious, robust technological change to bring to bear on this through the form of computational and algorithmic learning. I mean, this is where we can make the most difference.
Mr. Vice Chairman, if I can